was what?
She was a determined young girl who wants to achieve what's good for her in life. Okay. But unfortunately, she ended her life because she didn't get the help she wanted.
All right. Yes. What kind of person was Abna? She was the breadwinner. Everybody looked up to her. Perhaps the only person who had even attended uni from her village. So, a few weeks ago, I was talking to a midwife and asked if my daughter could have the cervical cancer vaccination. Yes, and then they were like, oh, how old is she? And I said, oh, I gave the age. And they asked what level of education. I told them she was in the university. And they said, oh, we normally start from around 15 when they are very young. And I said, oh, yes, she's well above 15, but she's a virgin. The midwife looked at me and laughed and said that, look, if you're at home, you don't know what is happening. Our daughters, our sisters, our friends are in school, and they are exposed to all kinds of things. Abna was a very, very good girl. And then naturally, she would fall in love. She finished uni, and then she fell in love, and then she had sex. And look at what happened to her. And so if you look within yourselves, you realize that we have all failed Abna, especially we, the midwives, because somebody said she confided in us. We were her last hope. We were her last resort. She came to us and we turned her away because of our values. So the fact that I am a Jehovah's Witness and I am not supposed to take blood, does it mean that when the woman is bleeding and dying, the woman should not have blood? Hello? Did somebody say no? Why? Yeah, because you can go for what we call consensuous objection. If you will not do it, you set up the tray, everything, and then you can ask your next in command to do it. But you should not judge whether the person should live or die because somebody has inserted stakes. Oh, Bonnie, Intimea, Meja Manewu. Now Ghana Health Service and the Family Health Division is telling us that we are institutionalizing comprehensive abortion care because we have already failed the woman once. If somebody comes with an unintended pregnancy, it means we have failed the person. We should have given the person family planning. And so once that the person has come and wants some service, please, what we do is to provide counseling, comprehensive counseling. The person does not just come and, oh, okay, welcome, come and lie down, I'll do abortion for you. No. The first thing is that, fine, you provide counseling, and the first counseling is what? Abstinence. But we all know there's not everybody who can abstain. And you'll be surprised that the people who come for abortion, most of them are married women. We have done the surveys and we have the evidence. Because of contraception failure, maybe the last child is too young, a lot of things happen. So it doesn't mean that the people are very bad people. Sometimes we say, ento wada. And so you offer family planning, but the family planning can even fail. If she refuses family planning and she gets pregnant, you counsel her, give her all the options. And yes, then the second or the previous one would be like 2 years. So consider it. You give all the counseling. And I'm telling you, sometimes when we give the counseling, the women or the girls say, oh, okay, I'll keep it. Sometimes you even ask them, oh, maybe you have an auntie who is childless. Why don't you give the child out We give all the options and you don't rush to provide the service. You even tell them, "Kona kodrin hu na bra." But then you are in the clinic, she has gone, and she has come and she tells you that, "You know what? I want this baby out." After everything, you counsel, she signs a consent form, and then you do the procedure. If you are doing the procedure and you start, and she tells you that, "I've changed my mind, I don't want to," please stop. Don't tell her that, "Master tray, master dear." No, it is her right. Stop. The only time when you cannot stop is when you have started the MA, you have given a part. That one you need to explain clearly. So before then, she signs the consent form, and then we provide service. We have realized that despite all these things that we are doing, stigma is still driving some women to the background. We stigmatize them. The adolescents, some women come, and even health workers stigmatize their colleagues who provide the service. No, Ghana Health Service right now is saying that our personal beliefs should not act as a barrier for a woman who is coming for service. Do we have any things to contribute to or any questions before we go on to the second very quick exercise, and then that will be the end of the VCAT? Any questions? Yes. Yes, good.
Please, mine is a question. Please, for the CAC, are we to admit or we can detain them?
Very good. A gynecologist will be coming to take you through MA and MVA. And I'm sure when he comes, he will spell the details. Now with MA, sometimes the procedure starts in the facility, and then the... Yes? Yes.
The cut-off point for a midwife as in gestation of the patient.
Very good. We all know that previously, CAC was just the preserve of medical doctors, but now midwives have also been trained, but midwives can only do up to 13 weeks. 13 weeks. But in this country, we know that second trimester abortion is also allowed, but that's when the doctors will do it. So 13 weeks for midwives. And you must be duly trained before you provide the service.
It's a contribution.
Yes.
And I'm saying if your values will not allow you or your beliefs will not allow you perform any abortion for someone, kindly refer the fellow to an appropriate person or facility for them to provide an abortion for the fellow.
Thank you. Yes.
For CAC, then you do it and there's a complication. Who do you run to?
Great. Before she comes, she's sitting right in front of you. She has thought about it. She could have gone to take any medication, but God being so good, she has come to you. We have realized that when you do it in the facility, the complications are very minimal, and when you stick to the required time frame. But in the facility, we have doctors, we have gynecologists, and so once we train you, all these people provide support. So when you are running into complications, please don't hesitate to call the next in command to support you. Because Ghana Health Service is institutionalizing it, they have made provision for all this. And when a 14-year-old comes, please ask them if they can provide somebody, an elderly person, to sign for them. If they do not have anybody, you can call a colleague to act in loco parentis as the guardian. We are saying this because if I am a Kayayo coming from Wa, I find myself pregnant, and you ask me to go and bring my parents, I don't have anybody here. But if you deny this young girl, she may go and do something, and then the next time you will regret. And so you are duly covered as a midwife to provide the service, but then always call for help. Yes, yes.
Sorry, in addition to why I asked the question is that what if there's a case where the complication is solved all right, but there's a debt to be paid? Is it the midwife who did it that will pay? Because the girl right now cannot, and then there's no relative who's aware. So
Who would like to answer? Yes.
Social.
You may start and it will not be complete, or there will be complications. So you may need to refer her to the next step. And when she goes, she may pay something before they will continue. So you have to tell her everything for her to agree and sign the consent form before you even start. So that is what we do.
Thank you. But I assure you, in the hospital, if you stick to the right protocols, the complications are very, very, very minimal, especially this afternoon. This afternoon you'll be taking through the MA and the MVA, and then you shall see. We are not doing DSC anymore. The MVA is very, very safe.
Please, to add to what has been said, I think that before every procedure, you would want to take a contact of a relation. So you would speak to the person in case something happens. Who should we call? Then when you have that information, there's a complication, you can communicate that to those people. And then another thing too is that most of the minors do not want their parents to know. But these days, most facilities have clinical psychologists to help midwives and other health workers in dealing with situations like this. I think we shouldn't work in isolation. We should learn to use these other cadre of staff that are in our facilities. Thank you.
So if the minor comes and tells you that I don't want my mother to know, please try and ensure that confidentiality. Somebody will ask, what if something happens and then you have to call the mother eventually? Yes, if something happens, you must call the mother eventually, because whose child is it? If you had this close relationship with your child, she would have confided in you. Once she did not confide in you and she has come to me and I'm helping save life, are you going to now blame me? Sit down and blame yourself. Hello? Yes. Okay, so the last one, and then we'll have just a 5 minutes exercise, and then we'll be done with the VCAT. Yes.
Okay, please, mine is contribution.
Okay.
And it goes to all of us. Most of the time, we are very interested in the money that is involved. So when the client comes, we don't even ask them to go and take scan for us to know the gestational age of the pregnancy. But we go on to do it, and most of the time, it ends in ectopic pregnancy. So please, when the client comes to you, make sure that you let the client take a scan. Thank you.
Thank you. Oh, there are several hands up. Okay, 1, 2, okay.
Please, I was going to ask about consent in the case of a minor. And then you already answered that someone else can sign for them. Now, my question is, just as you said right now, what if the parent is aware, but rather wants to keep the pregnancy, and the minor doesn't want to keep the pregnancy? Whose side do you take? Do you do it for the minor, or you allow, because if the child is a minor, it means that by law, her parents are supposed to make the decisions for her. So if the mother or the parents want to keep the pregnancy, and the child doesn't want to keep the pregnancy, where do you go to?
Very, very good. So as a midwife, you do not want to act as if you can solve all the problems in the world. You invite the parents, because you said the parents are aware, the child, and then you sit, you counsel them. They should go and resolve their problem. If they decide finally, then they come back, because you do not want to take anybody's blame. If you need to invite somebody else to join in and listen, the social welfare or whoever, please do. Do not act as blowman. You can solve everybody's problem. You can only do your best, and you have limits. Yes.
Yes, please, I want to find out whether you need to know the person's blood group.
Yeah, what do you think?
I'm asking because of rhesus negative sensitization.
Okay. So these are details that I wish I'll leave for the gynecologist, but the rhesus factor actually kicks in later in pregnancy. I think within the first trimester, I'm not too sure if the rhesus factor issue kicks in, but then let's keep that question, and then we will delve into that when the gynae comes in the afternoon. Yes, there's one person at the back, and then you. Oh, okay. Yeah. One person at the back. Oh, okay, good.
So I just wanted to add that with regards to the question my sister asked, when it comes to payment, maybe you do it and the person has to pay some amount and there's nobody to that. I just want to say that in very critical situations, if you assess the person and realize there's no hope, we can actually do it for the person for free. And it's also allowed. Like with the MVA, you don't really need you don't need much to do it, so you can do it for free. Maybe if it's the MA, then you may be thinking of the cost of the drug, but.
So the last one, and then we'll continue.
Please, about requesting for scan before procedure. It's not a mandatory something. We realize that most midwives are relying so much on scan results to make their decision in terms of MVA or providing CAC services. That's why we are talking of biomanual examination. Do your biomanual. If you are not convinced per what the client is saying, client says maybe I'm 8 weeks, your biomanual is giving you 4 weeks impression, then you ask for ultrasound. And then from a proper trained person, people are around the roadside giving things, yes, you don't really understand. No, with fetal pro everything, it says 4 weeks. No gestational size giving you 8 weeks. So midwives, let's explore further. Let's know what they are writing for us. When you pick a scan, don't just read the final comments and then, oh, they say you are 8 weeks. Which 8 weeks without fetal pulse? Thank you.
You're welcome. Right. Thank you very much. So the second part of the VCAT, I was doing most of the talking, but this time you are going to do the talking. I said it's very, very, very participatory. So we have 4 rows now, so we are going to divide ourselves into 4 groups. But let's remain seated where we are. So that's group 1, group 2, group 3, and group 4. So we would want to ask reasons why. So group 1, what are all the reasons why women have sex? So you will write everything. Hello?
Why you love sex? So please get a rapporteur and somebody who will be coming to do the presentation.
Please, we are waiting.
Great. So we only have 5 minutes. So quick.
Exercise.
Number 2, group 2. This is group 2. What are all the reasons why women have an unintended pregnancy? She did not intend to have the pregnancy, but then she finds herself pregnant. So all the reasons why.
She didn't.
You have 5 minutes. Group 3. What are all the reasons why women terminate their pregnancy? What are all the reasons why women terminate? You have just 5 minutes.
They call group 1.
And then group 4. What are all the reasons why governments regulate women's sexual activity, pregnancy, and abortion? You remember during my introductory statement, I said globally, every country look at women's health as one of the indicators to see if the country is doing well. So what are all the reasons why a government would regulate women's sexual activity, pregnancy, and abortion? Why would they provide family planning? Why, is the government doing all this? So you only have 5 minutes, and then the rapporteurs, you select somebody to come and do a presentation. Everybody should try and participate.
So well. Good. Welcome. Nice meeting you. A decade has been a very long while. Good. All right. So we'll be finished soon. Maybe within the next 5-10 minutes, I'll round up.
Four minutes more. Hello, are we done? Okay, 2 minutes more. Hello, shall we have some quiet, please? Group 1 is ready to present. So shall we have Group 1's rep?
Group 1. Thank you, ma'am. Okay.
Good morning. Please, I'm representing on behalf of Group 1. My name is Judith. We are to give reason why we have sex, right? So one is for reproduction. We have sex to bring forth to our new bones. Then the other one is for pleasure and orgasm. We have sex just to have the pleasure of it. Then exploration, to cure our curiosity. Sex, what is it at all? Then you do it. Then it's a form of exercise, isn't it? Very important. Then we also have sex to resolve conflict. Thank you. Then we also have sex for love and affection, isn't it? So that you can at least have a chest to lean on. We also have sex because we are vulnerable. If you don't do it, you don't get that job, isn't it? So you have to do it because you need to survive, right? For golf. Then we have sex because some people really have very high libido. They can't do without it. Then we have sex for money. People that's their job, right? Mm-hmm. Then we have sex for revenge. Isn't it? See these handsome guys, if I knew their girlfriends and they are my enemies, I would just do it. And make sure they know. Then, the married ones, also for mommy, we have sex because it's our obligation. Whether you like it or not, you are married, you should have sex, isn't it? So when you come, you cannot say no. So the Bible says. Then we also have sex to relieve stress. All right, so we also have sex to relieve stress. Then sometimes we have sex for the healing of it. When you get severe headache, go and fire. You will sleep and when you wake up.
Great. Yeah, let's clap. Let's clap for Group 1. So they've given us all the reasons why women have sex. Now let's call Group 2. Let's clap for them as they come.
Our question was, why are all the reasons why women have unintended pregnancy? And one is lack of knowledge on family planning or stigma. People sometimes they don't have knowledge about it. Some people also have, but they still give reasons not to do it. Number 2, lack of knowledge on menstrual cycle. People don't know their menstrual cycle to know when they are ovulating and when they are safe. And failed family planning methods, especially the natural one. Normally we tell them when you are breastfeeding, it's a form of natural family planning method, but eventually patients will come for the cyst when the patient will be pregnant, so it has failed. Then early marriage. Limited sexual education. We don't normally give education on sex. Defilement or sexual violence. When you are being defiled or being raped, you can get pregnant that you didn't plan for. Pressure from partners and peer groups. Mental illness. There's some of the common problems that we get with people with mental illness. They come to our facilities with pregnancies that they didn't intend to. So religious or cultural beliefs. Some cultural religious groups don't even go in for FPs. And in some cultures too, you have to give birth more so that you get a gift from your husband or wife. Drug abuse and curiosity. People are just curious to know what's pregnancy meant, and lack of parental control for our teenagers too. Thank you very much.
Yes. Do you want to add some? We also have rape.
Good. Okay. Yeah. Great. Good.
And most times too, they are not able to, without the permission of their partners, they can't go in for family planning. So they are not able to protect themselves from unintended pregnancies.
All right. Well done. And also incest. Yeah, sometimes too, some people want to test their fertility. The man will say, if you do not become pregnant for me, I won't marry you. And so they are forced to get pregnant before they marry them. So people have various reasons for getting pregnant, but then it was not intended. Please, are we together? Any more? All right, so let's invite group 3.
Group 3. Our question is, what are some of the reasons why women terminate pregnancies? So we decided to group them into medical. And one of the medical reasons is fetal abnormalities or birth defect, which if it is detected during scan, they might do it. Pregnancy complications, preeclampsia and eclampsia that can pose a risk to the mother. Health risks to the mother, sometimes cancers and heart diseases, liver cirrhosis, or any of the conditions can determine that the pregnancy should be terminated. Multiple pregnancies, one might ask why. Yes, somebody is already having 6 children and the scan says this one is 3. That alone can be a reason for this woman wanting to terminate the pregnancies. Ectopic pregnancy, which we all know the risks of it, can lead to termination. We talk of personal reasons why people do, and we said unplanned pregnancies. The woman was just having fun. She didn't intend to get pregnant, and she is, so she needs to abort it. Financial reasons. The economic situation can push someone into terminating. She was having fun, but she didn't think of the pampers and other things, so this can push her into a committee. Then career development. Just imagine somebody in this economy, you have been enlisted to the military, and you realize you are 2 months pregnant. What will you do? Or you are supposed to japa, then you realize that you are pregnant. That can impose danger. Will you? So somebody will do what? Will terminate it. We talk of age, either too young or too old. The lady is about 13 years. Hello, these are in 2 folds. We explain in 2 folds. Too young, realize that the pelvis are not adequate. The woman, this girl will go into risk if we allow her. That can be a reason. She's young and she's not even prepared psychologically. Though she can make it, but psychologically she's not prepared. She can abort. And then too old. We are looking at the maternal factor. She's too old and that can pose a danger. That can be a reason. Domestic abuse can be a reason. I'm with my husband, yes, but she's violating me too much. And this is a time I think I have to move on. And I'm pregnant. This can cause her to do. Then we are looking at emotional reasons why people terminate pregnancies. We are saying trauma or what? Rape. Rape situations or incest that we just mentioned, that can be a reason why somebody emotionally will terminate a pregnancy. Mental health issues, either depression or they fall into what? Drugs. This one can cause that. Then fear of what? Parenthood. Some people naturally will not want to be parents. I have an auntie who have married, they've signed a bond, they will never have kids. She doesn't want to give birth. This is that she fears kids and she will never want to have kids. And they've signed the bond before the marriage. This is a reason. So if this woman happens to get pregnant, she will do what? She will abort. Then loss of her autonomy or freedom. I want to go to nightclubs. I want to do hookups and I'm pregnant. I want to limit my freedom. So I will abort it. Then emotional what? Unpreparedness. I wasn't prepared emotionally for this pregnancy and it has come. So I will abort it. Thank you.
So, group 4, our question is, what are the reasons why governments regulate women's sexual activity, pregnancy and abortions? And these are some of the reasons. For population control, so government would want to do that to be able to control the population so that we will not have oversized population. Another reason is to reduce pressure on social amenities. So we all know when the people are many, there's always pressure on the social amenities in the country. And then for the general well-being of the woman, as in the health of the woman, yes. Another reason is also for women empowerment. So it helps them to be able to make informed choices. And then to also establish legal rights and responsibilities. So we all know that it's their right to seek some of this help. And so government makes these laws to be able to help them to exercise their legal rights and responsibilities. And then we know that women also happen to be the backbone of the nation. So it's also a form of support from government to women. Another reason also is to eradicate preventable deaths. So the scenario we had this morning, we realized that the lady's death was a preventable one. So when there are these sexual laws on these rights and regulations, it will help to eradicate these deaths. And then it also helps to prevent STDs. We all know it's self-explanatory. And then ensuring safe pregnancies and childbirth. So when there are these regulations, we'll be able to have safe pregnancies, and the childbirth process also becomes non-eventful. And then also to ensure children are born into environments that can be taken of. So once you are prepared, you get pregnant, you give birth, you'll be able to take care of your kids. They are born into environments that the children are not found wanting, or they don't go about doing wayward, And then another is also to comply to international standards. So we know that all rules and regulations of our country are being regulated by international countries. So as a country, we have to also conform to that standard. And then the last point that we have here is to prevent exploitations of our women. Thank you.
How do you feel about the exercise? You feel great? Yes. Has it helped you in any way? Yes. Okay. So the purpose of this activity is to broaden your scope, your views, so that we do not judge women because you don't know the reason why. I used to judge young girls who stood by the roadside doing hookups, until I know somebody who had to participate in a program in Nigeria where they had to protect young girls who had been taken as child slaves to other parts of the West African country from Nigeria. And then at least they were able, Plan International, were involved in some work, and then they brought them back. And when you talked to the girls, it was so sad. Some of them were told that they were being sent to a neighboring country to go and help, maybe go and as a house help, or go and work in somebody's store, only for them to come and they found themselves in brothels. Their madams collected whatever items they had, and then they would throw them on the streets in the night to go and do hookups, and then they took part of the money. So some of them, they do not even know. And so you should never, never, never judge. Our principles remain the same, but circumstances may change. It may be you. And so please, never, never, never judge anybody. Don't stigmatize. When the people come to us, when clients come, when women come, when the young girls come, let's listen to their story
empathize with them, counsel them, give them all the options, and then, when need be, please provide the service. So at this juncture, I'd like to end here, and thank you so much for your participation.
Oh, we can do better. Let's continue to clap while she's going. Let's continue. Let's continue clapping. What are we saying to our facilitator? Thank you very much for the nice presentation. Media, can you give us some little tunes so that we prepare ourselves for the next section, please? Some music.
Extension them are destined inside. Maybe you connect them this one by extension.
Let's start picking our phones because we're going on Facebook Live now. Let's start picking our phones. We'll be sharing the link now. On the agenda for today, we're supposed to have, looking at the first program, we're supposed to have a presentation or a talk from somebody very important this morning, but there was change in time. It will not be appropriate for me to introduce the person because this person requires a smooth voice for her introduction. So without much ado, I'm going to invite the first vice to handle this introduction of this important person in our midst this morning. I'll invite Sister Edith to come and do the presentation or the introduction. Sister Edith, let's give it to her as she comes. First Vice, she also doubles to be the co-host for this special program. Let's give it to her. Let's give it to her. In fact, she's doing great.
Unity. Midwives. Midwives. This morning I'm very excited because I have the honor of introducing my own boss, someone I deeply respect. She is a project director of CKID's Increased Gains in Nutrition, Education, Evaluation, Empowerment Project. She is currently a PhD holder in Healthy Policy and Management from the University of Ghana Business School. She had an MPhil in Nursing at School of Nursing, University of Ghana, MPhil Leadership at the Global Nursing Leadership Institute in Geneva, Switzerland. She is a nurse midwife, an educationist, and has served Mother Ghana for the past 38 years. She has imparted knowledge to many nurses and midwives at various levels from NTCs, university, private sectors, you can name it. She's also a member and board member on many committees, including Interagency Leadership Committee and the Ministry of Health, Kolebu Teaching Hospital, and many more. She is also an ICN abstracts reviewer and has many publications to her credit. She is a fellow of West African Postgraduate College of Nurses and Midwives. She is also a fellow of Ghana College of Nurses and Midwives, member of Sigma Theta Tau, I don't even know if I mentioned it well, International, member of Global Nursing Leadership Institute. This is even summary. It's actually, yeah. And she served as a vice president for nursing division at Ghana College from 2014 to 2016. But currently, she is the rector of the Ghana College of Nurses and Midwives. Ladies and gentlemen, help me welcome Dr. Hannah Ekia Oparibia Akwa.
Thank you very much, Edith. Don't mind Edith. She likes to pull my legs. All right, so I'm greatly honored to be here. I've been like you before, very bubbly. So I get excited when I see nurses and midwives, bubbly. So it's a good thing, because you slow down one day. All right, so this morning we want to talk about the Ghana College of Nurses and Midwives and the opportunities that are available to midwives. That's the reason I'm here. And I believe by the time I'm done with these slides, we will all get to know the opportunities that are available so that we grab them. Unfortunately, we are not seeing a lot of midwives climbing. I don't know what is stopping you. Nothing should stop you. Nothing is restricting you, my dear. Nothing is restricting you. The Ghana College is for all of us. It's not the reserve of some people. It's for all of us. And so let us be ready to take up the opportunity, all right? All right, so it looks tall, but I believe that in a short while I'll be done. Okay. So I'm going to talk about a little introduction and then through to a policy advocacy that we are leading as a college currently. Right, so why GCNM? The Ghana College of Nurses and Midwives was established for certain reasons, okay? It got to a point where the country, the ministry, the government realized that there was a need for specialized care. you know, everybody was a generalist, right? So you're put in the emergency department and you're a general nurse. So anything and everything comes and you panic. And people think that it's not normal. It's normal that you panic because everybody is interested in protecting their integrity, right? So we realized the need for specialized care for specific diseases, all right, for specific populations. So we saw that need. And then we also realized that a few people have the opportunity of going outside. It's expensive to train outside. So why not have a college here so we can train nurses and midwives in a very cost-effective way? Then again, to be able to motivate and retain nurses and midwives, these are a critical force that we need to retain in country so that we all are healthy. And also provide diverse career opportunities for nurses and midwives, which you're not taking up, you are not grabbing the opportunity. And then at the time, the West Africa College of Nursing, that's how it was called, also expressed the interest in having our own college. These are the reasons. So all these forces led to the establishment of the Ghana College of Nurses and Midwives. So the act was established in 2011. It was promulgated in 2011, and the act is called the Specialist Health Training and Plant Medicine Research Act. So this act actually establishes 3 colleges: the College of Physicians and Surgeons, the College of Pharmacists, and the College of Nurses and Midwives. So that is why we say Act A33 Part 3. So Part 1 establishes one, Part 2 establishes another, and so on and so forth. And the Ghana College of Nurses and Midwives is a postgraduate college, actually a postgraduate college. So probably in future when we have to amend the act, we would like to change the name and make it sound not like NTC, but to sound like a postgraduate college. And it's an established, it's also fall under this. Our mandate: specialist education, continuous professional development, postgraduate nursing and midwifery education, and then policy formulation. These are the mandates that's been given to us to run. And our core functions: to organize and supervise specialist training, CPDs, and research, conduct and organize specialist examinations. We also certify, and then we confer professional distinctions. We also foster cooperation with other institutions who have the same mandate, and then we participate in policy formulation. So the college has 4 divisions: nursing and adult health, midwifery and pediatrics, mental health and psychiatry, and then public health and community health, or whatever you want to call it. Somehow we are having double. In future, again, one thing we may want to amend is to have one name. If it is nursing, it is nursing. If it's midwifery, it's midwifery, and so on and so forth. It's one of the issues. Okay. The levels of professional development. So this is an area you'll be interested in. So we have the associate membership program. The associate membership program is for 1 year. It's intensive for 1 year, and it's the entry point is a minimum of a diploma. It means that you can have somebody with a degree and say that all I need is an associate program. We have had people with PhDs take associate membership programs. They think that's all that they need, all right? So that is it. And you need to have worked for 3 years. That is the policy of the employer, because we work with the employer to recruit into the program. So when the employer says, we want our staff to work for 3 years before they take the program, who are we to say no? Otherwise, they don't release you. Do you get it? So we work with them. Hopefully, this will be reduced. I am hearing that they're doing something about that. And then the next one is the membership program, which is the real program that we are mandated to run. The membership program is 3 years, and then you must have a first degree in nursing, in midwifery, in mental health, or whatever. You take it for 3 years, and you're done. You become a member of GCNM. Then the third one is the fellowship program. It's for 2 years. The duration is 2 years. You must have taken the membership program, the 3-year membership program. You could also be coming from abroad, maybe haven't trained in a similar institution. That is fine, we'll take you in. You take the program for 2 years and you become a fellow of the college. So these are the programs that we run. We have so many programs now, that's why I'm saying that if you don't come, then wallo walla. Yes, so as you can see, we have the programs under the divisions, all right? So we have so many. In fact, we have 20 membership programs running currently. 20 programs. And we have 6 associate membership programs. We have 6 fellowship programs also running. Okay? These are all our programs. And we'll continue to grow because we have, usually when we meet with the doctors, they're like, why are you running so many programs at the membership level? And I tell them, look, my population is larger than yours. And so the interests are varied. So we cannot limit ourselves. If we limit ourselves, people will not find their interests, isn't it? So we try to, spread so that people will be able to take the programs that they are interested in. Right, qualification for admission. A person shall qualify to be admitted into the college to undergo training for membership of the college if he or she meets the following requirements. I'm sure you'll be interested in this. Minimum academic and professional certificates for the program, minimum number of years of work, of experience, which I have mentioned already for the individual programs, good standing with the Nursing and Midwifery Council, very, very important. If you are not in good standing with the Nursing and Midwifery Council of Ghana, that alone can prevent you from gaining admission. You must submit a completed application form, pass the primary examination and interview, and then pay the relevant application fee. It's only this year that we introduced the primary examinations. Previously, when we started with interviews. But for standardization, because that is what every college does, you have to take the primaries. All right, and so we have also started. But typically the primaries are general questions, MCQs. Any nurse or midwife should be able to answer. So there's nothing so specific. The ethics, the leadership, or the administration, those things that any nurse or midwife should know, and so will be able to answer. Those are questions that you will find in primaries, not labor. All right? All right, the council may, on the recommendation of the academic board, withdraw a person undergoing training for membership of the college if she has failed to meet set requirements of the college or by the college. So you can gain admission by some error. If you get in there and we realize that you didn't come in right. Yes, it's happened before. Not once, not twice. So you don't want to tell us lies to come. All right, so professional programs shall be determined by the academic board in consultation with the relevant stakeholders and approved by the governing council. The college has a governing council. So typically the academic board determines the program, it goes to the governing council approves, and then we run. Okay. A program shall be delivered in accordance with the curriculum for each faculty as prescribed by the academic board and approved by the council. A program shall include the relevant activities for continuous professional development, training as associates, training as member, or training as a fellow. So all I'm saying here is that the academic board, you know, under the academic board, we have faculty. So, like, we have faculty of advanced midwifery, we have faculty of well woman care, we have faculty of neonatal nursing, all right? So, these faculties run the programs. They run the programs. There's no crisscrossing. They run their programs. But then when they develop the program, the academic board approves it, it goes to council, council approves it, and once the curriculum is approved, then it is the curriculum that is used to run the program and none other. That's what this means. Persons undergoing training shall attend prescribed lectures, tutorials, demonstrations, workshops, conferences, seminars, symposia, etc. under the program. So whatever is determined under the program, you have to take it. They rotate through accredited training centers as may be determined, work with assigned mentors or clinical educators who shall guide and support them for the period of training, and return assigned logbooks duly completed and signed by their supervisors. This we are yet to implement. But you will have to go through the dictates of the program. That's what it all means. So a little data. So this is about admissions. When we started in the 2015, we started with 30 residents. So when I say residents, these are the students of the membership program. When I say associate residents, they are students of the associate membership programs, okay? So we started with 30. The following year, 41. The following year, 65, and so on and so forth. Today, currently, let me say they started last month, right? It is last month, late September. And we admitted 398. So you can see the trend, isn't it? The interest is growing. So you cannot sit in your corner and be satisfied. You cannot. You can't afford to do that to yourself. If this thing came in my time, I would have taken it. I would have made sure that I got my own share. So get your own share. Yes, don't wait. For associate membership, look at this. We started with 37, 22. It started to climb. When we go to 2019, 2020, 179 started to decline. It tells you that now people are more interested in the membership than in the associate membership. So admission into the associate membership is going down. It's not climbing as fast as the membership. Don't be late. Don't be late. We did it with interviews, you didn't come. Primaries have come. Still come. So we have taken a total of 1,773 nurses and midwives into the membership programs alone. We are heading towards 2,000. And we have taken 823 nurses and midwives into the associate membership programs. That is where we are as of today. So you see I have highlighted those that are related to you, right? All right. So look at neonatal nursing. We have admitted a total of 98. We've admitted a total of 98. In fact, in all of this, you see pediatrics is leading. You see pediatrics up there because of Sick Kids, the Sick Kids program, and you know it was sponsored, right? So that one, a lot of people have grown interest into pediatrics. But neonatal nursing is not bad at all, 98. You can see how it comes. Then we have women's health. We started women's health and we stopped. We stopped because we realized it was too loaded And so we split that into, we had advanced midwifery and now well woman care, all right? It was too big, too large, right? So we stopped along the line. So when you look at advanced midwifery, we started in 2019-2020 academic year. We started with 5, it increased gradually, 5, 6, 10, 23, 19, and we have a total of 63, a total of 63. So you can see that's ongoing. And well woman care. Currently, I can say that we are having good numbers under all the programs. Advanced midwifery, well woman care, and neonatal nursing. This is associate, so you can see neonatal nursing there, 90, okay? You may find it difficult to see this, but this is about the resident population, okay? Currently, we have, let me say that we had 852 as of at the end of last academic year in August, okay? We are yet to add the new one. But then it tells you if we started with 30, and today we are at 852, it tells you we are running. I know that some people are scared. Some are shaken by that, but we are not perturbed. Yes, and CPDs. You know, we also mandated to run CPDs, okay? So we run CPDs. In our programs, we have mandatory CPDs that all residents take. These CPDs are supposed to help them to kind of add on to all that they learn, kind of spice it, right? So they take programs like patient safety, like communication in specialized healthcare delivery. Year 2, they take WHO quality rights, gender mainstreaming in healthcare delivery. In year 3, they take clinical leadership, they take knowledge translation, dissemination, and application of research findings as a specialist healthcare practitioner. So they take all these CPDs while they are still in the program, okay? But then we also have developed CPDs for, apart from our membership, for anybody who is interested to take. And in this quarter, we will launch them. So when you hear that we have launched some CPDs, you may also go for them. What I can say is that you can use it. They are recognized by NMC. They are accredited by NMC as well. And so when you take our CPDs, you can use them to also, you know, update your PIN, all right? So you can see those under neonatal, well woman care, and advanced midwifery. So these are the people we have graduated. So when you take the members, we have graduated 748 already. 748, and these people are working. They are in the system. Don't be that midwife who stays there and says, oh my book long, and then they go, they come back, and then you feel threatened. Why should you be threatened? The opportunities, it's a level playing ground. The opportunity is there for everybody. Some will not go. Then we'll wait. People will go and come. Their lives are better. How? Please don't be such. Because you see, to get to a point, you will think that it's too late. Like it's too late for me. Yes, it's too late. It's too late for me. That is why I didn't sit. I also looked where I can climb. So you have the opportunity. Please take the chance, all right? So we currently have 44 neonatal nurse specialists in the field, 44, most of whom are midwives. Most of whom are midwives. Then we have 10 advanced midwifery practitioners. We have 10 currently. Then we have, in fact, there will be more than that. I haven't added those who graduated last 2 weeks, right? Last 2 weeks. Those who came out last 2 weeks. I think advanced midwifery was 10, and well woman was also 10. So now they are 2020. So these are the specialists we have churned out over the years. And when it comes to the associate membership, look at neonatal. So far, 45. If we add the few that we graduated this year, I think 15 or so, it will go up to 60. Now the opportunities for you. This year we have added fertility nursing. We have added fertility nursing. So these are programs that are available to midwives. And I would like to say that it's not ending there. We'll continue to grow the division. So these fall under the division of midwifery. We have 4 currently. You're not so disadvantaged. You're not so disadvantaged. Sometimes midwives, I don't know why you want to feel that you are not being cheated. Mental health, they have 3. Public health, they have 1. We just added public health, 2. Start taking advantage. Start taking advantage of these programs. And we are hoping to also launch fellowship programs in this, okay? The good thing is that we are trying to collaborate with the universities, the public universities. So when you come and you do the membership program, they give you a little top up and then you come out with a second degree as well at the same time. So you come out, you have your specialist certificate and you will have a second degree. If somebody comes to do the fellowship, the person comes out with a fellowship certificate as well as a PhD. So this is what we are working at. Take a step. Take a step. Take a step before it's too late. All right? So recognition. Sometimes we're afraid. Oh, what's all then? I remember when we started. That was us. So people were sitting on the fence, sitting on the fence, and the young ones who were interested in taking risk came. And now they are specialists. Some have entered the fellowship program. Don't sit on the fence. It's not the best place to be. Okay? So when you take an associate membership program, you become a nurse in the specialized area, like you're a pediatric nurse, you are a neonatal nurse, you are an emergency nurse, and so on and so forth. If you are a member of GCNM, that means that you have taken the membership program, you become a specialist. So you're a neonatal nurse specialist, you are an advanced midwifery practitioner, you are a well woman care nurse specialist, fertility nurse specialist, and so on and so forth. I'm saying that the time is now. The time is now. The opportunities are there. Don't say you have no opportunities at the college. I don't want to hear that. Because you do have. If you didn't have, is Mabel here? Where is she? If we didn't have, she wouldn't have been a specialist. So you can't say that you don't have opportunities. So when it was just 1, she came. It was 1. She took the step. Is Vida here? Vida is not here. So even when it was 1, they took the opportunity. So if we have 4, and you sit there and say, midwives, any opportunity? It is not true. The opportunity is there. If you come and we say, oh, there's no space for you because there's no program for you, then you can say that. But no, there are programs you can take as midwives and go back, hold your chest up and say you're a specialist. Nothing stops you from coming to GCNM and becoming, so when you become a fellow of GCNM, you become a senior specialist. Gone are the days when you were a member of a college and you worked for a number of years and you could just climb up. Today it doesn't work like that. You need to come and do a fellowship program, and then you become a senior specialist in your area. When there's vacancy and you are very innovative, you're contributing so much, you'll be recognized as a consultant. So when I hear people go and they are fighting for positions, I ask myself, do they know who they are? You don't know who you are. Because if you know who you are, you won't go and fight for that. That hierarchy is not yours. You don't belong there anymore. You leave. It's a different hierarchy altogether. All right? So, midwives, and add, and serve yourself as well. We save lives. So, expectations of the specialists. We expect that when you pass through our program, it must show. You go out there, there are people out there, products out there who are shining. When you go out there, you must shine. If you don't shine, they won't see any difference between you before and you after. In fact, today it's not even good to do before and after. Don't see a difference between you who has gone and come and those who have not gone. You'll be same. And we don't want to see that. Competency and professionalism. So the things that you would have been fighting for, you will not fight again. Mabel and Co., have you stopped fighting for consulting rooms? You have to stop. You have to stop. When you climb higher, you are more humble. That's what you should be. Anybody who is high up there and is not humble, akanakakra. Yeah, I'm telling you. I'm telling you. When you're climbing higher, you should be more humble. That's what people must see in you. Virtues. That's what people must see in you. Values. That's what people must see in you. So you don't go fighting. Hey. When I hear people are fighting, I ask myself, do they know that they are specialists? They forget, oh. They forget. You are a whole specialist, and you are standing there fighting, exchanging words. So people see you and they don't. As I say, when you do you get what I'm saying? Yes. So people don't talk to you anyhow. You are a specialist. It must show. Passion to save. When people are fighting for offices, you must be fighting to save lives. That's what you should be doing. That must take your time. Already, you were called to save lives. So it deepens. You want to do everything to touch lives when you become a specialist. Strong academia, research, clinical and managerial practice. People come to you and they feel you. Students come your way and they feel you because you see, you are able to impart knowledge and skills. You're supposed to be doing all of that. That is what we will expect when we see your faces from next year. I'm looking at the faces very seriously. Help me to mark register. We'll see those who are here who will come and those who will not come. If you have not expressed interest, go express interest and stop sitting in one place. You can do more than you're doing. So don't limit yourselves. Mentorship, preceptorship capabilities at all times. You should be able to mentor people. When you're mentoring people, it means you're replicating yourself, right? You want to bring people up to be like you or even better than yourself. That's what we are talking about. Drive change for improved readiness to practice at all levels of care. We train you in such a way that you can work everywhere. Whether independently or with people, you should be able to work. Teamwork, research, and skills in program management. I know that most of our products are providing CPDs and trainings in their areas. True or false? Madam, Mabel, true or false? Yes. And we are proud of them. We are proud of them. Induction ceremony. So what it is that once you have gone through the program, you will have to be inducted. I'm saying this because people think that it's the university. It's not the same as the university. When you come to college, you're done, you have to be inducted in person. You're inducted, and then you go out there and practice. That is when your name goes into the college book. That is when your name will be sent to the Nursing and Midwifery Council that you have passed through the college. And then we put your name in a register, and then we give you a certificate. And when we give you the certificate, you are proud that you're a member of GCNM. It's not the same as masters. If you should calculate, it's higher. Right. So we award certificates. In fact, we confer distinctions, we give awards, and so on and so forth. This is the future outlook of GCNM. We want to launch more fellowship programs. The reason is that we need to grow as professionals. We've gone a step into specialization. We want to go higher. We want to even have consultants amongst us. And you are the young ones. So please, start working hard. Edith, will you lead the way? Edith will lead the way with some of you. Yes. So we want to grow as a college. We want to grow as a college, and we want to grow the professions of nursing and midwifery. We want to make a change. Let me tell you something. We are sitting here and underestimate our own college, and Sierra Leone has been here to learn from us. Malawi was here last week. Yes. As we speak, Nigerians have come into our programs. Botswana is here. So I'm saying, don't sit here for people to come from their countries to come and take the opportunity while you sit here. All right? The opportunity is already there. You don't need anything special. You're already more than qualified. So nothing should stop you. We also want to complete the setup of a more user-friendly website. We have done that. We're still trying to complete it. Then we want to collaborate with some NMTCs to run our associate membership programs. We're looking at seeding the associate membership programs to a few NMTCs. We work with them to run the programs in the name of GCNM. There'll be GCNM programs. And what we also are encouraging is that they affiliate with the universities so that when they take the programs, they come out with first degrees. So that whilst the college, Central College, is producing specialists with masters and fellows with PhDs, the NMTCs who will be running will also be churning out associate members with first degrees. So we grow as a college and as professionals. Then our long-term goals, we want to decentralize with programs across all 3 zones of the country. We have zoned the country into southern, middle, and northern belts. And what we don't want to do is to see people come from way up down south. So as much as possible, so don't be applying, don't come from Bole and tell me that you want to come to Accra, unless your program is not in Tamale. We don't have a lot of programs in Tamale. Some of them, yes, you will come here, but there are others that are being run in the north, and we want them to remain there. We don't want you to come too far to take your program. So we're trying to decentralize, and we'll continue to do that. Currently, we are training Cape Coast Teaching Hospital. They're asking us to come and train more programs, run more programs there. So we'll continue to do that. We're in Konfanoche, we're in Kolebu, we're in PML, we're all over the place. We want to try and use all the regional hospitals in training, all right? And so that you don't need to struggle to come all the way to Accra to take your programs. We also have a 2-acre land currently at University of Ghana. They've given us 2 acres of land, and we are working towards building our permanent infrastructure. We have a design already currently. Hopefully we'll be able to put up a befitting. We're special, so our infrastructure will be special, befitting for us, yes. And then we want to also we'll continue to seek local and international partnerships and collaborations. We have a few. We have World Child Cancer helping to train pediatric oncology. We have Sick Kids helping us. Now we're looking at adolescent health and so on and so forth. We had Roche help us train oncology nurses. The term is coming to an end. We're hoping that it will be renewed. We'll continue to do that and see whether we can get some more. USAID is coming on board, hopefully, to train neonatal nurses. So, but the thing is that these partners, when they come, they are more interested in associate membership because they think that, 1 year and you churn them out. 1 year and you churn them out. That's what they are mostly interested in. Yeah, but as much as possible, we'll sell the membership programs to them. Then Postgraduate Specialist College of Excellence in the African region. This is where ultimately we are aiming at. We want to be a college, a postgraduate college of excellence in the whole of Africa. Indeed, there's no college except ours. We are the one and only as we speak. Others want to learn from us, yes, but we are the first. And we want to improve on what we do, improve anymore. Policy advocacy. So we have advocated to the ministry that we want the situation where every nurse, every professional nurse, after the basic, must determine his or her area of interest, then specialize. So it will come out. So you won't be able to sit down. If you won't move by yourself, we'll push you to move. Yes. So that you go to fellowship and all you do is intrapartum care. Fellowship. You specialize in a smaller area. You become an expert in that area. All right? So think deep, and think big, let it frighten you. Let your dream frighten you. And when it frightens you, it makes you make the move, you understand? Because then you know that you need a lot of steps to get there, and so you have to start early, all right? And we also are advocating that if anybody is teaching, whether in NTC, whether in the university, if the person is teaching pediatrics, that person must be a specialist in the area. Another advocacy there. So that's what we are doing. So we are believing that as a college, we will be providing a strong window of opportunity to people like you for diversification in academic, clinical specialization, and leadership. We believe that. So let our belief come true. If you sit on the fence, it won't happen. And I'm seeing that the nurses are pushing. I don't know what is preventing you from pushing. Is it because of your numbers? You like catching babies? You like catching, continue to catch. And you like catching, you now catch your baby and we move. No, steadily you start working at it. We will discuss that. We'll discuss that. We know what's happening. It's all politics. All right, so we are hoping that we will, through the college and our programs, rebrand nursing. That is why we get disappointed when we see specialists fighting. And some dress anyhow. When I used to teach, yes, when I used to teach, you came for lectures dressed anyhow, I'll sack you. The next day I come with lime and deodorant. So my students love me. I'll tell it as it is, and I'll help you out. So let's dress properly. Specialists, no address it, but not in an amho. I'm not sure I can say. Do you know that your appearance will take you anywhere? Just because of your appearance, we are nobody. Because you pass and they look at you and hey, where there's a Madam B. You will get to where you want to go to. So I'm saying that the appearance is as important as your knowledge and skills. Don't have the knowledge and skills, the competencies, and leave your outlook, you need to look good. Hey, why? All right, so we also hope that this whole vision of the college will drive passion for humane care. That even as we care for patients, we treat them like human beings and not like pieces of wood. When I used to work on the wards, you realize that we had nurses and midwives who were busy free. You know busy free? They are smart, they are smiling all over the place, and hey, what to say? She is the most liked by patients, I'm telling you. So if you are so technical and all you do is catching babies, catching, and one day here, no mercy, catching. Oh, catch you, thank you. So when you let us do it with joy. I'm telling you, the busy free nurses who were smart and laughing and hey, what to say? Then they'll be like, what to say now? Always, they say they are the best nurses. They don't do anything. I'm saying that you need that as well. The technical alone doesn't take you places. Add that, humane care. And that brings me to the end of the slides. For us at the college, we believe in teamwork. We believe that every individual in the college is important. Everybody contributes to the growth and development of the college. And we're asking that you come and join us and build our professions of nursing and midwifery. Thank you.
Oh, let's do it again. Let's do it again. Thank you, Rector, for the nice presentation. We will take some few questions, but let's acknowledge our brothers watching us from the house on Facebook. Our brothers and sisters watching us from the house. They are also bringing their questions. Continue to share the links. They have questions for our Rector, please. John Kanse say, great delivery, mommy. Yeah. So we will first take the questions from here, then we'll go to Facebook and take their own.
Yeah, good morning. Mommy, thanks for your presentation. My question is, where I'm coming from, per the steady leave quota, I realized that we were given 2 slots for the neonatal nursing. That's the associate's program. And when you look at the Ghana Health Service portal, it's not in there. The advanced midwifery, midwives want to go and do. When you open the Ghana Health Service portal, it's not there. What crime have we committed? Thank you.
Thank you so much, Mommy. I think my sister asked one of my questions. But the next one is that I want to find out whether the college considers midwifery as a specialty. And if yes, if something can be done about it so that at least we can also do some few weeks like how our colleagues, ENT and other ones do to get associates, so that we'll be able to gain admission and do 2 years for the membership if you are going to do the advanced midwifery instead of the 3 years. Thank you.
Please, let's take 3, then Mommy answer, then we'll continue. First 3.
Thank you, Doctor, for your presentation this morning. Please, I have 2 questions. So I realized that, as you said earlier, the associates and then the membership and the fellowship, some of our nurses have degrees, but not in midwifery or in nursing. Some have degrees in education, some have degrees in anesthesia, some have degrees in physician assistantship. Can such programs, people with such programs, can they come into the membership and to the fellowship programs? That's the first question. Then my next question is, we are midwives, but then some of us are working in areas where we attend more to medical issues than to the midwifery part. I work in a department that is called fetal-maternal medicine, MFM. What we do in that ward, basically, we take care of pregnant women, postpartum women with medical conditions. So the cancers, the leukemias, the renal failures, all those women with such conditions, as long as there's pregnancy, there's postpartum, they are in my ward. Can such a nurse working in such a unit move from the midwifery, although she has the midwifery certificate, can she come to do palliative nursing? Because most of the conditions in that ward, they need the palliative care. Can such a person go across board to come to do palliative nursing? Thank you.
Okay, thank you. Allow Director to answer, give us some few answers.
All right, thank you very much for those questions. Let me try and answer them. Small slots. That is where the competitiveness is. Because as a college, we cannot take everybody at the same time. All right, so the employer tries to make sure that every region has a certain number. That is why they come in with the small slots. I think that that is what the Ghana Health Service does. So if they want to bring 20 people to the college this year to do neonatal, then they would say every region bring a certain number. So you're likely to see those small numbers. Do you get what I'm saying? Of course, we cannot take everybody to at the same time. So let's continue to do it. People have come. So, and I know that typically they would want to look at how many years you have worked. So if you have worked for quite some time, they will not hesitate to give you steady leave. And I also know that those who come from the underserved areas are given a shorter time, shorter work experience to come to the college. So that, yes, but as we grow, it's likely we'll increase the numbers. So if we increase the numbers, they will also increase their numbers. I'm not sure whether, I think it's their own formula. I must say that because there are other institutions who will bring more than 2 people to do one program, like UGMC, like the teaching hospitals. But it's because Ghana Health Service is big, it's large. They try to share it amongst the levels, at the levels. So probably the reason. But please, don't let that deter you. Then the other is advanced midwifery. So let me say this. Recently, I had a meeting with, college met with the DG. And so he has asked us to go and prepare something and come and meet with him. So we are working towards that, the advanced midwifery. But let me tell you that some of these things, you know. You and I know. You and I know, because for instance, we have family health also being a problem. We have family health, and Ghana Health Service is not allowing people to do family health. So we're taking these up, and so we'll work out on that. As for fertility nursing, is new, so I'm not surprised that they didn't release, but we're going to discuss all of these. Hopefully next year, it will be open up to you. Hopefully, we'll work on that, right? Then somebody was asking whether we recognize midwifery as a specialty. This is a very hard question. A very hard question because at the time I did it, it was post-basic. At the time I did it, it was post-basic. Recently there was a meeting and I said it, I advocated. Can we make midwifery post-basic? Maybe it didn't go well. But you see, as soon as you put anything down there and say it is basic, it is basic. As soon as you say it is basic, it becomes basic. And that obstetrician you're working with is seeing you way down. Meanwhile, you've learned so much. Am I making sense? Yes. When we did it, it was very post-basic. I did nursing, and I went to do midwifery. And so the recognition was different. However, we'll see how it goes. We'll discuss and see. But I think that we can still lift it. I have asked, can we move the midwifery up? And until you move it up, recognition comes with paper. Do you know that? It comes with paper. As soon as you put on it certificates, RG and RM, a penna a square, a basic, then it becomes basic. But we'll discuss at leadership level and see what we can do about that. And that is why we said advanced midwifery. And you see, even that one, we're kicking against. That is a very soft way of saying no, isn't it? It's a very soft way of saying no. So I cannot promise that if somebody does midwifery, the person can come and do top-up. I'm not sure yet. But like I said, it can be discussed. Now, if I had my own way, midwifery should not be basic. Midwifery can stand alone after basic and is still alone. Don't critical care, don't they have their own association? So it will not kill the association. It will not. This has been discussed though. It's been discussed. Even the president of JRNMA, in one meeting we all tried to say, like, look, let's do something about this. But it hasn't caught fire. I will continue to discuss and see. If I had my own way, midwifery should be a specialist program. If it was post-basic, in Kenya, look at what we are doing for critical care, public health, all of them, because basic. The reason is post-basic. The reason is post-basic. But I'm saying all is not lost. We'll continue to discuss and see if there's a way out. That's what I can say for now. All is not lost. All is not lost. All right? Then there is, some people have done degree in anesthesia and all of that. We expect that those, for physician assistantship, please, it's not nursing. So they can't come to us. If somebody is a physician, a nurse, or a nurse, so that person cannot come to us. But the nurse anesthetists, I know they are making moves to come to us. And we have told them they should come. We sit down. We'll see what they can do. Probably critical care. Probably. So when they come, we'll discuss and we'll see the way forward. Those ones, we can deal with them on an individual basis and see whether they fit in anywhere. Okay? Education. Is it B.Ed you are talking about? Oh, B.Ed, that's for B.Ed. B.Ed is difficult. No. B.Ed is a no-no. We have been able to work with the UDS people. What do you call them? The nurse practitioners. Because what we did was to map, look at their curriculum and compared with the first degree. And we realized there's a very slight difference. So for them, now we are taking them into programs. Yeah, so they have the opportunity. But B.Ed, no, not yet. Not yet. Midwife to do other nursing programs. Do you want to run away from midwifery? You said you are enjoying, your friend is saying, catching babies. There may be programs that we can look at and discuss at higher levels. So that we will deal with on an individual basis, but it is not open, as in open. One of the reasons why we didn't even allow midwives to go into pediatrics is that we don't want to move the midwives from. How many midwives? Already we don't have enough midwives. True or false? I'm looking at those in the system. Why would the midwife leave midwifery and go and do pediatrics? How are they linked? Neonatal, yes. But how is it linked? We need midwives. So we will not remove midwives from midwifery like that. No. But I'm saying that there may be specific ones we can look at. Like the one that the lady talked about, could be discussed. But there's no way we are going to, oh, midwives, nursing. Now, who nursing? You saw nursing and you said you were interested in midwifery. And it's a beautiful profession. Why would you get here and move away from midwifery? We will not even allow you. Because we will be doing a disservice to the professions and a disservice to healthcare. Rather, let us grow you in your area, if you ask me. Midwifery is a beautiful profession. You don't want to leave. You don't want to leave. And I'll help you leave. But I'm prepared to grow you in the area and be who you want to be. Yes, that yes. All right. Thank you. I think that's about it. The questions are done. Any more?
There are more questions. Let's go to Facebook and take about 3 questions from there. Fuseni Bawa is asking how many working experience does one need to be qualified to start as a membership program? Felix Breco also want to know, please, are there any plans in place for government to provide scholarship for programs at the college? Christolite Gusiapia also want to know, please, are midwives limited to only the midwifery divisions, or they can also read membership in critical care, hematology, or oncology? We will take this for now.
Let me start from the bottom, because I've answered this and I'll say it again. I am saying that is why we have nursing, we have midwifery. Why don't you say, will you go and will we allow you to go and do mental health? And you chose midwifery, please remain in midwifery. There are programs that we may, I have said that already, based on some peculiarities we can look at. Even that will not just open the window like that. But we will say that remain in midwifery and grow in the lines of midwifery. Grow in the lines of midwifery. Okay? That is why there is what we call the multidisciplinary approach. If you need a critical care person, what stops you? Why should you leave your midwifery and go and learn critical care and turn yourself into a critical care nurse? You tell me. Sometimes nurses, we are confused too. We confuse ourselves. Have you seen a doctor who is a medical doctor or obstetrician saying that Mikoya critical care? Would they call the critical care people to come? Tell me. Is that not what it is? Why do we want to do jack of all trades? It doesn't help. Oh. It doesn't help. It gets to a point people are looking at, where do you belong? You belong. Stop it. Stop it. Stay where you are. Grow in that area. If you need a critical care nurse to come to your aid, pick a phone and call the person. Otherwise, what's the relevance of that person? What's the relevance of that person? You tell me. What's the relevance? That is why when she also comes across somebody who, or a worker, she'll call you. She will not turn herself into a midwife. She shouldn't turn herself into a midwife. Please stay in your lane and grow in your lane. You can grow. Stop looking into other people's. I said, "Who did not help you?" Obedience akono. Amudi na akono. Sir, akono papa. Share. You don't know. Akono. Ask those who have taken the programs, and they'll tell you they are proud that they took the programs. If you want to look in, when you have neonatal nursing, it is yours. Take neonatal nursing. All right. Plans for scholarship. We have written to the ministry severally, and we continue to push. As we speak, government is not in a position to support us. That is what we are told. So currently, there's nothing coming from the ministry in terms of scholarship. What they do is that they have told the facilities to support as much as they can. So you realize that some facilities are able to actually support with scholarships. The unfortunate thing is that those who are coming from the underserved, where the needless deaths occur, they don't have money to support their nurses and midwives. That's the unfortunate aspect. But we'll continue to push. Every year we send a communique. We are asking them to support us. And I believe that whenever they have money, they will support us. But for now, we have nothing of that sort. Work experience for membership, and I indicated that. The employer says 5 years. If you want to do membership, 5 years. So if you are a midwife, a professional midwife, and you want to come and do membership, and let's say you've done your first degree, we will not count from when you took the first degree. It is from when you started to practice. And but we take out the national service. We take out the national service, all right? We don't count from when you took. So you can do first degree yesterday. Once your certificate is ready and you have worked for 5 years, you can come to us and you. Wow. So please, that should not, I'm sure a lot of you, almost all of you have done 5 years already. What were you waiting for? Are you the only ones who don't hear what is going on about college? Edith, you have failed them. All right, thank you very much. Any other?
We will take 3 from here, then we will let our rector rest.
All right, thank you for the opportunity. Okay, so this is a plea before the question will come. Earlier on, you showed us the slide on the various programs that you offer in the university. I would be very glad if you could display it so that we'll capture it and it will help us in making the appropriate decision. And I also want to suggest if GCNM can make online programs available for some of us in Ghana and also outside Ghana, so that such as the Well Woman, it's not so much of practicals. So I think if that can be considered, it's not so much of practicals in the sense that with advanced midwifery, you need to go for clinicals and do some practice and all that. But with the Well Woman, it's quite, please allow, it's quite minimal. So if we can consider some aspect of it so that we could capture worldwide, because some of us are really interested in that, even though our country doesn't recognize that yet, as well as the facility. And then also, I want to suggest that most of our midwifery programs, I've realized that it's being developed from nursing. With what you've even displayed, we have neonatal nursing, we have well woman care nursing. I think since, even though we are fighting to stand on our own, if we can make it attractive, maybe neonatal midwifery is in relation to that, so it will attract us to be able to get there.
Jaisa, you know, this is the thing about us.
Okay.
We never want to go international. If I gave you neonatal midwifery, you go out there, they don't recognize it.
Okay. No, please, education, I beg.
They don't recognize it. When we develop programs, what we do is that we go international and we see how is it couched.
Okay.
How do we prepare such graduates? Because you will not be here. And you want to go out. Let me tell you something. A lot of our products have gone out. What is Nobody has been sacked, and the reason is that we developed our programs and made sure that they are standardized, internationally standardized.
Okay.
So we will not run any program with a weird name. We will not.
Okay.
It is a one far. You are the one who alone will suffer. But please, when we give you programs, we are giving you programs that are recognized everywhere.
Okay.
Okay? Neonatal nursing, go out there, everybody knows. Midwives take neonatal, midwives take neonatal nursing.
Okay.
Don't worry about that.
All right.
Don't worry. It doesn't move you away from midwifery.
Okay.
Because neonatal, tell me the midwifery you do with a neonate.
I asked that because of the question that was asked earlier on about midwives. So I'm just trying to ask for knowledge.
All right.
And
So,
I like that.
great. So what I'm saying is that midwifery has boundaries. And you cannot push midwifery beyond that boundary. Okay. You cannot. Okay. All right? So let's remain like that so that when you go out there with that certificate, you'll be recognized.
All right. Thank you. My last question.
Oh, let's ask.
Last question. Please, if you have MPhil midwifery and you want to come in as a fellowship member, or let me say, fellowship, please, how do you go about it? So I have MPhil midwifery. I want to come in. That's a master's program, which, with your explanation, is, I don't know whether it's similar to membership. How do I come in and where do I belong? Is it membership or fellowship? Thank you very much.
If you came in with MPhil in midwifery, I will look at it. Because at the college, we do 30% theory, 70% practice. And you and I have been to the university. We know that it is theory, theory, theory. Tell me how many practice you do. So it is likely that you will take it again. They are not the same. MPhil midwifery is not the same as advanced midwifery. For us, the training is done in the field, online, and no. When you see us doing online, then they would have teased certain aspects that you can do virtually. But most of the time, it's in the field, all right? 70% practice, 30% theory, okay? So the same way, let me tell you that, also let me clear this, that Well Woman Care is recognized. All our programs are recognized in Ghana. The college was established by an act of Ghana Parliament. So every program that we run is recognized by the employer. Okay? Ghana Health Service releases a lot of people to do Well Woman Care. It's rather advanced midwifery, and we say we're going to talk about it. But they're all recognized. Ghana Health Service is not releasing people into advanced midwifery. CHAG is. The teaching hospitals are. So it's a Ghana Health Service issue. Do you get what I'm saying? It's a Ghana Health Service issue. So we'll deal with that and have it solved. All right?
Okay, Ma, please. I stand to be corrected, but may I know, I learned that study leave is very compulsory as a requirement when you want to enter into GCM. And I want to ask those of us at the training institutions, if your principal allows you where you don't have a study leave, but it tells you that you can go and do it, how do you go about it since it's a compulsory aspect? Thank you.
All right, so we don't take words by mouth. We don't work with words. In fact, even Ghana Health Service, if your regional health director writes to me and says he's giving you study leave, I'll redirect you to go to the head office. Because the head office is the one that will release you completely and give you the study leave. True or false? So what happens is that, which some people don't know, Ghana Service will always give us a list. Before we do our interviews and all of that, they give us a list of the people they have given provisional study leave to. So if you sit in your facility and your facility head writes to me, it won't work. Because Ghana Health Service headquarters gives me a list to work with. So I always advise that, yes, your facility is ready to release you. Work with headquarters. Make sure your name is on their list, all right? Yes, we take study leave. As for study leave, we don't joke with it. Because what happens is that when we don't insist on the study leave, you come and then release becomes a problem. If you force and you go through the program, it will not be recognized. Do you remember that degree thing? It will not be recognized. We don't want that. It's happened before in the early days. And there were people who had to wait for years for Ghana Health Service to recognize and give them the grade. We don't want that to happen. Ghana Health Service says no. The employer says no. They want to give study leave before we admit you. So when you come, and we go through the interview and we haven't seen your study leave, usually we'll tell you, go follow up. There's a little time, go follow up and get them to do it for you. Do that. As for study leave, it's a must. It's always a must.
Thank you, Rector. There's a question online,
Yes.
which I think I would like you to address for us. It says, please, Rector, what associate program do you have in your college for midwifery tutors to become associate members?
What
associate programs do you have for midwifery tutors? Or what programs do you have for them to become associate members?
All right, so we had a VP at the time who was not interested in associate membership programs for midwifery. In fact, I don't even see how you can do associate membership in advanced midwifery to start with. Do you get what I'm saying? And for me, I think it's okay. It's okay. You must aim high. Please. Associate membership, do you know that? And so if you want to do something, if you're a lecturer or you are an educator, you want to take a program, do the specialist program and be recognized as a specialist. That is where we are heading to. That's where associate. So please, I will advise that educator to rather specialize. And the schools, they allow. Once you express interest, you want to come. We've had some people come into our programs. So please, tell them, we don't have associate under midwifery except neonatal. So we have neonatal, which they can take.
Okay, well noted. Please, this is my question. After having completed GCNM, can I use my certificate to do another program in the West African College? Does it qualify me to do a program, to take up a program in the West African College? Or I can use it in other countries to practice? The other thing is that, the other question is, do we have people who are not in Ghana Health Service, they are not under MOH, they've moved into private practice, and they are ready to or willing to sponsor themselves? Do you still require a study leave approval, or once they show proof that they are funding themselves, they can gain admission to GCNM? Thank you.
Thank you. I'll start from there. They will have to prove to us that they are off job. They'll have to prove to us that not only are they paying themselves, because sponsorship means I'm paying myself. And we have a lot of nurses in Ghana Health Service and all those places, and they pay themselves. But they need study leave. Study leave means no job. You are on training full time. That's what it means. So I need you to let me know that you're coming full time. That's what it means. Study leave means full time. So I don't have a problem if you are. We've had a few people from private also coming, right? But you have to prove to me that you've gone off job, so that you will not be skipping and working. Do you get what I'm saying? What was the other question?
The one that has to do with after the program, I can use my certificate to do the West African College.
So let me say this. West Africa College programs and GCNM programs are parallel. They are parallel. Our programs do not continue at West Africa College. So you say, I'm going to continue there. If you want to go and take a program at West Africa College, it may be entirely different from what you took. That's what I mean. It will entirely be different. So if I were you, I won't do membership here and go and look for general nursing at West Africa, because what they do there is adult nursing. It's not nonsense. So why would you do, let's say you've done oncology, then you go and do general nursing? It's like something is wrong. Because the other day I was advising them that they should start thinking of specifics. If you specialize and it's a general program, it means that it's still general, isn't it? You may want to narrow down. So I won't do oncology and go and do general nursing or adult nursing. If they are doing pediatric oncology there, fine, I can go and do pediatric oncology. Am I making sense? Then you are narrowing down further. But as we speak, programs are parallel. There's no one that is running into the other. So it may be difficult. It may be difficult to say that I've done a program in GCNM and I want to take the certificate to go and continue. I don't know what it will look like. You may find out, but I'm not sure what it will look like. Okay? Any other?
Please, mine is just a clarification I'm seeking. We're having a program with our Kenya counterparts, and then most of them, let's say all of them, were being introduced as nurse midwives. So I want to find out, are CHNs and then enrolled nurses who have gone to do post-basic midwifery and then degree midwifery, nurse midwives, or do they require to do a course to be certified as nurse midwives? And do we have that in Ghana? I just seek clarification. Thank you.
All right. There used to be. Today we don't have. I am a nurse midwife because I did nursing and I went to do midwifery. So I became a nurse midwife. So if you want to, the nurse midwife is somebody who has done general nursing and has zoomed in to do midwifery. That is a nurse midwife. So if you're hearing in other countries they are saying nurse midwives, it means that they do nursing as a basic. And they do midwifery either as a post-basic or as a specialty. That is why they are nurse midwives. That is what I am advocating for. So that is what I've been talking about all this while, that if we had that, we could even have pushed the midwifery to college level. Do you get it? All right.
Good afternoon. Please, I want to take this opportunity to say thank you very much, because I am a product of the advanced midwifery first batch. Yes. And we are doing a lot out there. So I will therefore encourage each and everyone here to pursue more into midwifery. Thank you very much.
Thank you. Thank you. This one, I won't add anything. She said it all.
Ma, please, I want to find out if you are not getting the steady leave with pay and you rather get steady leave without pay, and will you be accepted?
If you bring me steady leave without pay, still steady leave.
Oh, okay.
Once it is signed by Ghana Health Service or your employer, that's fine.
All right. Thank you.
Thank you, Mama. Let's acknowledge our colleagues on Facebook. Our colleagues are still with us on Facebook. They are not of. Only one question. Ayoko Krampa said, "That's my MTC tutor. Great presentation. See you soon, Mom." Judith, Edu says a beautiful delivery. Thank you, Mahana. Rector Boatma says it's time to take a step. And the question follows. A member wants to know the difference. A member wants you to throw more light on the difference between Well Woman and Advanced Midwifery Program. Thank you.
All right, thank you very much. And thanks for the compliments from my daughters. Yes, so the titles speak for themselves. Advanced midwifery is midwifery in the advanced form. You do more advanced, okay? So I remember when we were talking about advanced midwifery, and Ghana Health Service was like, what's the difference between midwifery and advanced midwifery? It's the same. What's the difference? You see, when they start doing that, then they want you to remain there. I say, oh, isn't it? I said there's a difference. But she has told us that there's a lot they are able to do. Right. So advanced midwifery is midwifery in an advanced form. Well woman care is preventative. Well woman, it tells you that you don't need to be sick to go and see that specialist. All right, so you have all the, from adolescent to through their lifespan, isn't it? So me, I can come to a well woman care specialist and say, I want to be checked. She'll do all the checks, cervical, she'll do all of those for me. She'll counsel me. Are you getting it? So there's a difference. There's a big difference. There's a big difference, all right? It's more preventive than curative. Any other? What was it? Oh, I've already said that it is full-time. So online, and I've specified that whenever there will be anything online, it is not the full program. Usually, they'll tease from the curriculum what they can teach because they don't need skills. But most of it, you need that face-to-face, you need that clinical touch. Especially, even well women, they do a lot of. So why are you saying it's more, it is not more theory than practice. There's a lot of practice, a lot of it. Yes. I can't speak to all programs, but fertility is about infertility. And it's also open to midwives. And nurses can also take it. Fertility. So that one, like we all know, you're helping those who are not able to get pregnant and give birth or carry pregnancy, that kind of thing. So it's fertility. And it's also a good one for midwives, right? All right, thank you very much.
Thank you very much, Mobi, for the time. 2 hours standing and still standing. In fact, she has done very, very, very well. Let's continue to give it to her. Yeah. Our sisters and colleagues at home, we appreciate you for your time and your comments, as well as your questions. We will continue to answer your questions on Facebook. Anybody having questions for our rector too, can push it on our page. We will send it to her so that we get answers for you. We will be taking pictures with the rector. So media team, can you help us to set up and take pictures with the rector? Okay, this is how we are going to take the pictures. Rector will take a picture of herself alone. So mom, you mount the portrait for us so that you can take your picture. The first vice will join in. NEC and all the coordinators, get ready. Regional coordinators and National Executive Council, Midwives Society, let's get ready. NEC Executive, please, it's your turn. National Executive, Midwives Society, it's your turn. Please, NEC, we are waiting for you. Monica, Sasara, Cynthia, come, please, come on. Coordinators, regional coordinators. Regional coordinators. Ashanti region, Central region, and Northern region. Please come. Ashanti region, Northern region, and Western region. Western, Ashanti, Northern. Please, you are combining. Please come. Northern region. Northern region, Ashanti region, and Western region. Okay, thank you. Central region, Brong-Ahafo region, and Eastern region. Eastern, Brong-Ahafo BA, and Central.
Voter. How are you able to voter? And I can't hear. Oh, sorry. I'm not reading the list. I can't read it, right? Voter. Something I'm a voter.
Okay. Voter region, Greater Accra. Voter, Greater Accra. Voter region, Greater Accra.
Upper West join.
Upper West can join. Upper West.
Upper East. Upper West is there. No worry, they will appear. So you want that?
We will join Upper East. Join Upper East, so you should have made Upper East, Upper West. How many join?
Upper East, please join. Upper East, the last region. Upper East, the last region. Upper East. Thank you very much, Mommy, for your time. We are most grateful. We are most grateful. We shall continue to remain in our seat whilst we've seen our mom off. Please, let's continue to be in our seat whilst we say goodbye to our mom. Mom, thank you very much for coming. Oh, we can do better. Let's come for her as she leaves.